Hello, my name is Greg Foltz. I'm a neurosurgeon who specializes in caring for patients with brain cancer. I'd like to talk to you a little bit about brain cancer today. The best way to do that is to actually have you imagine that you are a patient, not unlike many of my patients who one day is living your normal life, feeling fine, feeling well. Usually in your 30s or 40s, with family, with a job, living life to its fullest. And you experience sometimes something quite subtle and strange, perhaps a headache that doesn't go away, a feeling of numbness or weakness, maybe tripping on words, something that to an everyday person might not seem very important, but with you it has persisted and perhaps gotten a little bit worse, and it worries you, and it worries your family. You go and see your family doctor and they get an MRI scan, and the MRI scan shows that you have a tumor. What happens next is one of the most frightening and terrifying experiences that you can experience. Within days, you're taken into an operating room, have an operation, and you get a diagnosis. And that diagnosis is cancer, brain cancer. Now, what does this mean? We've all heard the phrase cancer, and many of us have heard the phrase brain cancer. But few of us know the devastation of this disease. It's incurable. The average survival is just 1 or 2 years. Patients who have this know that there's just a limited amount of time that they have to try to get the disease under control, to give them any hope at all of stability in their life. So from the minute they get their diagnosis, they know that they're fighting a deadly disease every day. Now, we live in the Pacific Northwest, which is one of the great areas of the country for its advances in medicine and science. But if you're a patient with brain cancer in the Pacific Northwest today, and you look out across our landscape at all of these great resources that we have, you would be surprised to find that very little of that is devoted to brain cancer.